My name is Josh Houry, and I am the Community Relations Coordinator here at the Saskatchewan SPCA. On behalf of the One Health Education Committee, welcome to today's webinar. I would also like to take a moment to acknowledge the land where I am today. The land on which I live and work is Treaty 4 territory and homeland of the Métis. I honor and I pay my respects to the First Nations and Métis ancestors of this place that we now call Saskatchewan. The One Health Education Committee helps to improve the quality of life for animals and humans by providing education for animal welfare and human service professionals. This four-part Zoonoses webinar series explores the complex relationship between animal diseases and public health. Today's presentation will discuss a sample of some of the most important diseases of livestock that can potentially cause disease in humans. We do invite you to share your questions using the Q&A feature at the bottom of your screen. If you hover your mouse down near the bottom of the Zoom window, you will find a menu bar pops up. One of the options there is the Q&A button. You can click on that, submit your questions, and Dr. Campbell will answer questions as they come in. Plus, we will have some time at the end of the presentation for questions as well. And you can also just pop your questions into the chat and we can get to them through that location as well. Today's presenter is Dr. John Campbell. Dr. Campbell graduated from the Ontario Veterinary College, University of Guelph in 1985. After several years of rural veterinary practice, he returned to Guelph to complete a Doctor of Veterinary Science degree in Ruminant Health Management. He has worked as a clinical faculty member on the Ruminant Field Service Practice at the Western College of Veterinary Medicine, University of Saskatchewan since 1991. He served as department head of the Department of Large Animal Clinical Sciences from 2011 through 2017. His primary research interests are in the fields of beef cattle production, medicine, and disease surveillance in beef cattle. He currently acts as the director for the college's Disease Investigation Unit. Dr. Campbell, welcome, and thank you for being with us today.
Thank you, Josh, and thanks for hosting me, and thanks for the land acknowledgement too. Important thing to do. So just a brief outline of what I'm going to talk about today, and I'm going to sort of try to cover some of the zoonotic infections of farm animals. I obviously can't in 1 hour cover everything, but I'm going to try to, I sort of pick and chose the ones that I thought were the most important. So this is kind of an outline, talk briefly about what a zoonosis is. If some of you were here at the other webinars, you may have covered that already, but we'll just briefly cover that. And then I'm going to talk about some of the maybe less severe diseases like the skin diseases like orphan ringworm, then get into some of the more enteric infections, talk a little bit about lambing and zoonotic infections and the importance of issues around small ruminants when they give birth. We'll just briefly touch on some of the government, what I call the government regulated zoonoses that still have importance, but maybe are a little rarer in our part of the world, and then finish off with what we can do to protect ourselves and keep our own personal safety. So as most of you know, a zoonosis is just any disease or infection that's naturally transmitted from vertebrate animals to humans. And they can be bacterial, they can be viral, they can be parasitic, and they can involve unconventional agents like mad cow disease even. And as well as being a public health problem, lots of these diseases have significant impacts on animals and prevent the efficient production of food of animal origin, and sometimes they create obstacles in international trade. So this is sort of the definition from the World Health Organization and how they define a zoonosis. My simple definition is it's any disease of animals that can be transmitted to humans, no matter what the route of transmission is. And as we'll discover, you know, the route of transmission is a pretty important thing to understand, especially when we start to try to think about controlling these diseases or preventing their spread to people. We kind of talk about the route of transmission being the soft and underbelly of disease. So it's important to understand that. We have diseases that are quite severe and others that are relatively mild, but they're all classified as zoonoses. It's important to remember, though, that infectious disease is a two-way street. And so, yes, animals transmit diseases to us. we also transmit some diseases to animals. So a good example is methicillin-resistant Staph aureus in horses. It's an important antimicrobial resistant infection that we see in hospitals and in the community. It turns out if we go around and culture horses' noses in Saskatchewan, we'll find horses with MRSA as well. The MRSA that horses carry actually is the same as the community-acquired MRSA that we see in people. And it looks like probably people are infecting their horses with MRSA, and they carry it around as a carrier, just like some people do. Interesting, pigs also have MRSA, but the strain of MRSA that pigs carry is a specific livestock strain, and people that work with pigs can be infected with that strain as well. And influenza viruses can go back and forth between pigs and people and poultry as well. Obviously, infectious disease goes both ways. So I want to start off by talking about a couple of the maybe milder diseases, talk about ORF and ringworm, and fairly common diseases. ORF is this skin disease of sheep that's sometimes called sore mouth, and we mainly see it on the face of bottle-raised lambs, although it doesn't have to be just on the bottle-raised lambs. It can be on lambs that are suckling their dam. It's really a highly contagious disease caused by a virus called pox virus, and it can be transmitted by direct contact, animal to animal, or by infected equipment. So bottle-raised lambs, they'll spread it very quickly if the equipment is not cleaned in between feeding lambs. And if you get ORF, or this infected with a particular pox virus, it's something that a lot of physicians may not be as familiar with. It's not a common disease here in people because there's not that many people working directly with sheep, but this is a common thing that you'll see if you're around lambs at lambing time. It actually causes these painful kind of ulcerative lesions, usually on the hands, similar to the lesions that it causes in the lambs, only in the lambs and the ewes, it's usually on the mouth of the lambs and on the teats of the ewes. The sores can last for quite a while. They'll take a while to heal, but they don't usually scar. And it's usually self-limiting. It goes away eventually. Can cause more severe disease in immunocompromised individuals. So the big thing here is we want to wear protective gloves when we're handling potentially infected animals and working with lambs. Another pretty common skin disease, and probably one of the most common zoonoses that we see, is ringworm, which is a fungal disease, a fungal infection caused by the fungus Trichophyton verrucosum, causes areas of hair loss and thick and gray skin. And I expect most people that have worked with cattle have seen ringworm from time to time. Often when I was in private practice, some 4-H individual would come up to me and say, "Oh, my calf's got ringworm. How can we get rid of it?" Well, it's tough to get rid of. It's certainly more common in confined cattle during the winter. It's usually calves or yearlings. We don't see it as often as in adults. And it's a very common zoonotic infection. You can see these raised lesions on this individual's arm here, which are the sort of typical ringworm lesions. It's tough to control in animals. We try lots of things and most don't work. And once it gets on a farm, it's tough to eliminate. It gets transmitted directly from animal to animal, but it also lives on what we call fomites. So anything in the environment like fences and wall edges, environmental contamination, it can survive there as an arthrospore. It tends to be a self-limiting disease, so it'll go away eventually. And that's why maybe we have all these different quack treatments that people think work, but they probably don't really. There are some thiabendazole ointments, and some people have tried fluoride toothpastes and all sorts of antifungals. But if you're going to try to treat an animal, it's got to be applied at least once daily, probably for several weeks, and it's probably questionable effectiveness. There is a vaccine in some other countries that seems to be effective, but we don't have it available in Canada. So a couple of pretty common diseases: ORF in sheep, ringworm in all sorts of animals. We can see it in horses and in cattle and in sheep as well. But they're relatively self-limiting and not terribly severe. So now I want to move on to enteric diseases. And these are diseases of the intestinal tract. And I'm going to talk about 4 in particular here: Salmonella, Cryptosporidium, enterotoxigenic E. coli and Campylobacter. I'm going to spend a little time on Salmonella, especially because of its importance. We have lots of strains of Salmonella bacteria, both in animals and people. And some of these strains can be antibiotic resistant, which makes them difficult to treat. And one of those strains that has recently emerged in Western Canada and throughout North America in the last 10 years or so is Salmonella Dublin. And it's a host-adapted strain, which means it likes to live in a particular host and survive in a particular host. And in this case, the host is cattle. And there are other host-adapted strains for various species, for pigs, for sheep, etc. The infectious dose for Salmonella for you to get it is actually pretty high. And so if you hand wash and wear protective clothing and things like that, should protect you from a clinical case. Obviously, the disease in humans, most people understand what Salmonella is like. It's mainly diarrhea and vomiting. Occasionally, we can get some more severe forms in immunocompromised individuals and elderly, and the very young probably have to be super careful around this disease. Just to show you, and this data is a little bit old, but just to show you that prior to 2016, this was not something we saw very often in Saskatchewan. This is diagnosis from Prairie Diagnostic Services here at the Veterinary College, the diagnostic lab. And then you can see over the next few years there, all of a sudden, each of those cases is probably a herd outbreak, and we started seeing it more and more. And I can tell you that those cases have continued to increase. And all of these are sort of multi-drug resistant. They're resistant to sort of 4 or 5 major antimicrobials that we use in livestock, so they're very difficult to treat. So Dublin's a little different than some of the other Salmonellas. It's a host-adapted serotype, and so it actually tends to create septicemic infections or bloodborne infections that get into multiple tissues in the animal, not just the digestive tract. So typically in some of the other Salmonellas that we see, Salmonella enterica, they tend to be more intestinal infections, and we see bloody diarrhea and enteritis, things associated with the intestinal tract. Salmonella Dublin actually causes a systemic infection, and one of the most common presenting signs is respiratory disease in these young calves. So it's a common disease in dairy cattle. We're starting to see it in some beef herds now. And what's challenging about these host-adapted strains is that if the animal survives and recovers, they can enter a chronic carrier state, and they can have sort of lifelong infections, tend to be asymptomatic most of the time, but then every now and then they'll go through a period of intermittent shedding and start to shed it again. So it makes it very, very difficult to control in a herd once it's in there. And we have significant infection rates in dairy cattle throughout North America now with this disease, and we're starting to see it in some beef herds as well. It causes pretty significant mortality when it goes through a barn, and we also sometimes see abortions in cows as well associated with it, which is a little bit different than some of the other traditional Salmonella. So it's bloody diarrhea off feed, like we'd see with almost any Salmonella, fever, but we sometimes see pneumonia and abortions, which is a little bit different, and it can sometimes be misleading. Even the veterinarians will start thinking about pneumonia, causes of pneumonia, and won't think about Salmonella quite so much. So pretty significant disease. But we do see other Salmonellas too. This calf had Salmonella typhimurium DT104, which is a non-host adapted strain, a strain that we see in a variety of animals. Almost anything with an intestinal tract can carry that one. This was an outbreak in southern Saskatchewan a number of years ago, where a number of herds were infected as they brought animals into the clinic, and the vet clinic became infected as well, and it transmitted to a bunch of people. It was a fairly significant outbreak. So Salmonella transmission to people, it's mainly fecal oral. So it's that stuff you learned in kindergarten, separate your poop from your food and make sure you don't contaminate anything. But also Salmonella is an important food safety issue. Milk can be a vehicle for transmission to humans from dairy cattle. The milk can be contaminated from feces on the udder. Salmonella is largely killed by pasteurization, so that is the major food safety issue we have there, but it's still an issue if we have raw milk or unpasteurized cheese. We've seen outbreaks of Salmonella caused by those sort of food products. From a meat point of view and food safety there, it's mainly in the gut. So all the things we do at the slaughter plant to prevent contamination of the carcass at slaughter is important. Any contamination will be on the surface. So it's really ground beef that we would worry about, or ground pork, ground chicken, things like that. And then poor storage or poor cooking will play a role in spreading that in terms of food safety issues. Another common zoonosis, Cryptosporidia or cryptosporidiosis. It's actually a single-celled parasite. So it's a very tiny parasite. We can only see it on a microscope. Causes calf diarrhea, but also causes diarrhea in lambs, kids, foals, a variety of species, some small animals as well. There's actually 4 species in cattle, and one of those species, Cryptosporidium parvum, actually infects people and calves as well. This one's highly contagious, so you need very small quantities to become infected. And it seems like every year now and then we see an outbreak in our veterinary students who are dealing with calves at the springtime of year when calving season is happening. It can get into water supplies, and it's somewhat difficult to control in calves. It's hard to treat. We do have some products, but it is difficult to treat and control. Causes a pretty nasty enteritis, but we get a good immune response and get some immunity from it after they go through it. Can cause major problems in immunocompromised patients, and this is a common infection in HIV patients who can often have significant compromised immune systems. Some of you might be old enough to remember the big outbreak of Cryptosporidium that we had in North Battleford in 2001. There was about 50 people hospitalized. This was probably not a zoonotic infection. This was probably people infecting people. Where the first infections came from, not sure. But in North Battleford, the wastewater treatment plant was about 3.5 kilometers upstream of the intake for the surface water treatment plant, and they had a sedimentation failure in the water treatment plant. And through a series of mistakes and miscommunications, I guess the city didn't inform the Battleford Health District. It's actually a local family doctor who's started noticing these high sales of diarrhea medications, ordered stool samples on all his patients admitted with diarrhea, and then found Cryptosporidia. They notified public health, and they fixed the water treatment problem and stopped the disease. So there's been several outbreaks of Cryptosporidia like this that go through water treatment plants. Those are probably human forms of Cryptosporidia, not necessarily the cattle form, but we do see this in cow-calf and dairy herds as well as in sheep and goats. There's lots of E. coli out there, and all animals are carrying E. coli in their intestine, as are most people. But there are specific strains of E. coli that actually cause severe disease. And we sometimes call these the enterotoxigenic E. coli or the Shiga-toxin E. coli. They have a number of different names. Some of you may have heard of the well-known strain H70157, and sometimes called Hamburger disease. However, there are other strains as well. What's interesting about these is that the strains like H70157, they live in the cattle intestine, but it really doesn't cause any problems in the cattle. So they don't get sick at all, but it can cause severe disease in humans. The main disease that we see is called hemolytic uremic syndrome. It can result in kidney failure and quite severe disease, and again, more severe in immunocompromised individuals. It can get into water supplies, and I grew up not far from Walkerton, Ontario, that had a fairly major outbreak of E. coli H70157. Again, contamination of the drinking water, a problem with water chlorination. Probably did come from cattle in that case. There was cattle grazing around one of the wells that served the town of Walkerton. But because of problems with the chlorination system and the testing system, it got distributed to people and caused a fairly severe outbreak. It can also contaminate crops through manure spreading. So lettuce, spinach sprouts, bean sprouts, apple cider. There's been a number of outbreaks, food safety outbreaks caused by that. And then the other big concern is fecal contamination of meat at slaughter, and hence the name Hamburger disease, because that's when they grind hamburger, that surface contamination can get spread through the meat. And if it's not cooked properly, people can be infected. So most of our mitigation for this disease is at the slaughter plant. We do carcass washes, steam mitigation, all sorts of testing, et cetera, to try to make sure we have food safety. But certainly if you're handling cattle and handling animals and are exposed to feces, there's a chance that you could become contaminated with this if you're not careful about your hygiene and hand washing, et cetera. The final one that I want to talk about briefly is Campylobacter, and there's actually a couple of strains of Campylobacter. It's a very common foodborne bacterial infection. One of the most common ones, causes pretty severe diarrhea and abdominal pain, but most people recover in a week to 10 days. But it's not much fun to have, and often young children and elderly may require hospitalization if they get a severe infection. Probably mostly through raw or undercooked meat or unpasteurized milk or untreated water are the main things. We do get direct from farm animals, occasionally fecal oral spread. And Campylobacter is an important cause of abortion in sheep. It's a common fecal pathogen in sheep, cattle, pigs, probably highest level in poultry, and it's a common cause of food poisoning from handling raw poultry meat. But as I said, this is one of the common causes of contagious abortion in sheep. You can walk around, carry this infection with no obvious clinical signs, but we do see abortion storms caused by it, and the infection can be transmitted through the infected placenta and contaminated bedding. We do have some vaccines available for this disease in Canada. Which leads me to this topic about abortion in sheep. And there are lots of causes of infectious abortion in sheep, and many of them can transmit to humans. And probably I should say sheep and goats, so small ruminants. So this is one area where pregnant women especially, but probably all individuals, need to take a little more caution when handling sheep around lambing time. And pregnant women should maybe even avoid it completely. Handling contaminated tissues at lambing is the primary route of transmission. So people that are lambing ewes should be wearing gloves. Pregnant women should probably avoid contact. There is some respiratory transmission as well, which I'll show you in a minute, that might need extra special care to avoid. So here's the list of zoonotic infections at lambing time that we see in sheep and in goats to some extent. And some of these will cross over to other ruminant species. So there's a long list. You can see that most of them are oral transmission. So we have to be careful about wearing gloves, washing our hands, doing things like that. And things like Salmonella, Toxoplasma, Leptospirosis, they're all quite common causes of abortion. And Campylobacter, which we covered already, Cryptosporidiosis is in there as well. But there's also some of these diseases that can be transmitted by inhalation. So Q fever, Listeria to a lesser extent, and chlamydia. And I want to spend a little time talking about Q fever in particular, because it's one that's not often well understood or well recognized, but it is actually quite a common infectious pathogen in animals in all of the world, really, especially in ruminants. So this is a bacterial disease. It got its name because they didn't really know what to call it. I think it got diagnosed in some area of Australia, and they wanted to name it after that area. And somebody said, well, no, we don't want to have our area name a disease named for our area. So they changed it, and then they changed it to something else. And eventually they called it Q fever, which stands for query fever. In other words, they weren't really sure what was causing it at the time. Now we know it's a bacteria called Coxiella burnettii. It can infect goats, sheep, cattle, most ruminants. It also infect cats. and it's a cause of abortion in all these species. Transmission is really in three different ways. One is handling infected material. So that's things like the placenta or the lambing, the fluids in the uterus at the time of lambing or on the lamb. Another significant route of transmission occurs via inhalation of contaminated dust and infectious aerosols. So that one gets especially important here. And then this can also be transmitted through food, through raw milk or unpasteurized cheese. It's interesting, there's been some big outbreaks in parts of the world. Holland had a very large outbreak a number of years ago. There's been outbreaks in other parts of Europe described where people get infected just being downwind from an infected sheep or goat farm, and this bacteria gets aerosolized in the dust and gets spread to other people. The symptoms can vary a little bit, but can cause pretty significant flu-like syndrome, fever, headache, chills. I got fever in there twice. It must be a bad fever. And but occasionally can cause quite a bit more severe disease and can cause hepatic involvement, heart valve infections, endocarditis in more severe or chronic cases. And some people can get a chronic form of Q fever that can be very difficult to treat. So just a graphic here that this sort of flu-like symptom, the bacteria actually lives inside the cells of the animal. They spread the germ when they give birth largely, so they're not really very infectious at any other time of the year. And then people who help those animals give birth, such as farmers or veterinarians or people that work with those animals, have a higher chance of getting Q fever. Wind can carry the barnyard dust and spread it downwind. And so if you breathe in this dust, even if you aren't close to those animals, you can become infected with this particular pathogen. So in animals, an infection with Q fever is usually subclinical. There's no obvious clinical signs other than the potential of it causing infertility or abortion. So we don't see the endocarditis and things like that very often in animals. That's sort of the disease of people and the flu-like syndromes, but we do see infertility or abortion, both in cattle, sheep, and goats. And some serological studies out of Canada actually suggest that 50 to 60% of sheep and goat operations have at least one positive animal, and the prevalence can be pretty high on dairy operations as well. Again, as I said before, the greatest risk of transmission is really at lambing or calving. These animals aren't shedding this in huge numbers at any other time. And in fact, if we test them, sometimes they'll be serologically negative before lambing and then serologically positive at the time of lambing as they start to shed. There's some vaccines available in Europe, but it's questionable how effective they are. They may reduce shedding in infected animals to some extent, but we don't have anything directly available here in Canada. Controls mainly through biosecurity measures. So, separating the lambing ewes from others and controlling airflows to minimize transmission, composting manure before land application, and minimizing dusty environments. It's a tough disease to control. Certainly, there's some recommendations for people that are going to be handling animals, especially at lambing or calving time. And if you have any of these sort of conditions, pre-existing cardiac valve disease, artificial heart valves or grafts, arterial aneurysms, some sort of immunosuppressive conditions, or pregnancy, you should take special care, also infants and geriatrics as well. Pregnant women especially, there's a risk of miscarriage, stillbirth, premature parturition, and intrauterine fetal growth retardation. So it's not something to take lightly, and it's just one more of those issues around the time of lambing that we have to be aware of in sheep especially, and also in some of the other species. So how to protect yourself from Q fever? Obviously, if you're in that high risk of serious disease, you should just avoid situations that lead to exposure and not be around a lambing barn or a calving barn. Obviously, others can wear personal protective equipment like gloves and protective outerwear. You might want to consider respiratory protection. You probably need an N95 mask, which we're all familiar with these days, and splash shields to be completely protected in that sort of sense. Josh, you got a question?
Yeah, we do have a question that's come in, and the question is, will typical treatment protocols for respiratory disease in cows be effective against S. Dublin infections causing respiratory distress, or is a different treatment protocol required?
Yep, that's a good question. So back to Salmonella Dublin. No, we don't have any. We don't have any specific. None of the vaccines that we specifically use for respiratory disease are going to protect against Salmonella Dublin. So this is a completely different infection. And what happens is that because one of the clinical signs is respiratory disease in these young calves, we might get misled into looking for those kind of diseases rather than looking for Salmonella. There are some Salmonella vaccines available now for animals, but I'm not sure that we have one specifically for Dublin here in Canada.
Thank you. And one other question about Q fever. And the question is, Q fever seems more common in sheep. How common is it in cattle in Canada?
It's probably almost as high. I don't know if I have good data on that. I think I saw a seroprevalence study in the US, and I doubt we would be a whole lot different, where something like 60 to 70% of dairy herds had at least one animal positive. So it's fairly high in dairy cows as well. It seems to be that where we see zoonotic cases in people, tend to be more associated with sheep than they do with cattle. So maybe cattle don't shed it quite as much as sheep do at the time of calving.
Thank you. And those are all the questions that we have at this time.
Okay. The other thing that's interesting about Q fever is that if we measure people in high-risk professions, so veterinarians, veterinary students, animal health workers, farmers that work around sheep or cattle, they often have fairly high seroprevalence themselves. Often 60% of them will have antibodies to Q fever. So they've been exposed, and they probably may have had mild clinical disease at some time, but the number of documented sort of severe cases is pretty small. So probably there's lots of people becoming infected with this and not having serious disease. But if you do get the serious disease, it's certainly not something to be taken lightly and can cause pretty significant medical consequences. So even though we're worried about it, obviously there's lots of people exposed to it and not getting severely sick. So this is just sort of a risk category thing for Q fever that they put together in one of the documents that sort of tried to give us some management principles around Q fever and sort of to think about what are high risk animals and low risk animals. And if you just go down to the bottom, you can see that the highest risk animals are periparturient small ruminants, so sheep or goats, from a herd or flock with a known history of Q fever or coccidiosis, or from a herd or flock with a history of abortions or stillbirths. So obviously, if you're working with a sheep flock and there's an abortion problem, that's sort of the highest risk. Interesting, there's been several outbreaks of Q fever associated with cats giving birth as well. So they've got that in the high risk category as well. Intermediate risk is now, calving small ruminants, calving cattle, and felines that have been confined to the indoors. And then the lowest risk are male ruminants, non-pregnant female ruminants, or pregnant small ruminants that are not in the process of lambing. So, probably pretty low risk if we're working around those kind of animals, but if we're working with animals at lambing time, it's something to be considered as a potential zoonotic risk. So the final ones I want to talk about, and just briefly, are some of these, what I call the government regulated zoonoses. Many of these have been either eradicated in Canada or significantly controlled by government agencies. A few years ago, we had an outbreak of tuberculosis in Alberta that spread in some cattle herds, but we have very, very few cases in Canada. We're tuberculosis free by and large. But in countries that have no bovine tuberculosis control, 10 to 20% of the human cases of TB can be attributed to the bovine form of tuberculosis. The rest are sort of human tuberculosis. Brucellosis, also eradicated in Canada, used to be a significant zoonosis, caused a disease called undulant fever, which wasn't very nice to get. You had chronic, long-term, intermittent fevers and flu-like syndromes in those people that got it. Again, transmitted somewhat like Q fever with placental fluids and things like that at abortion. So it was a common disease for veterinarians or farmers to be exposed to. But again, pretty low risk in Canada. We were declared free back in 1989 and really not a big issue at all. Anthrax, we still see from time to time in Western Canada. It's one of those rule outs we think about when ruminants die suddenly, but it's a pretty rare disease in humans. We had a big outbreak in Saskatchewan in 2006 in cattle, and there were 2 human cases associated with it. And both of these were skin infections. And that's the common anthrax lesion, is this skin ulcer that you see in that picture there. And 95% of human anthrax cases are really associated with that. Again, it's a rare disease in animals, a rare disease in humans, but it is something we see from time to time in Western Canada here. And then finally, rabies, and I won't spend much time on that. It's obviously an important disease, but relatively rare in Western Canada, but it's always a consideration in any animal with nervous disease symptoms, and we probably need to take precautions if we have any animal exhibiting nervous disease, any mammal, we should be worried about that. When I was in practice in Ontario years ago, I saw many rabid cows through a couple of years when we had a lot of rabies in the fox population. And you know, they would have pretty vague sort of nervous disease symptoms. It would be pretty easy to miss them if you weren't paying attention. So it's an important rule out and something to consider, and probably people in high risk situations should consider getting vaccinated for rabies in advance. So to finish up, I just want to talk about sort of why we should care about this, and obviously there's sort of 4 reasons here that we want to think about. First is our personal safety. If you're working with animals, you should have some idea of the risks and how to minimize them. And I know many of you on this webinar are people that work with animals on a regular basis and probably are aware of some of those risks already. In some cases, I think if you get sick and have to visit a doctor, it's nice for you to give them some idea of what you may have been exposed to. And some things like ORF and things like that are not common diagnoses for physicians, so they may not see them a lot. They may not be as familiar with them. So for you to give them that history and that background, that may help your own physician as well. If you have employees that work with animals, you're really technically responsible for their safety at work, and that includes exposure to disease. So they should be aware of the risks and how to mitigate them. And I think this is one we often don't think about very much, but farm visitors or petting zoos, we often have school trips and fair exhibits and all those sort of things. There is the potential risk of disease transmission. Agribition's coming up in a little while. There's lots of people walking through those barns. And if you get involved in that, or you're leading one of those sort of trips or something like that, everybody should have some idea of the risks, and we should take some actions to mitigate those, at least hand washing and things along those aspects. And then finally, public health. We can have some diseases of livestock spread to animals, to humans in a fairly massive way, either directly, but often through products such as meat or milk, or food or water contamination. So it's an important public safety and public health issue as well. Really, the personal safety on the farm and ensuring your own personal safety comes down to pretty standard basic practices. Hand washing and protective clothing, which are common sense, and most of us think about those, but I think we sometimes get sloppy and don't pay as much attention to it as we should. Many of these diseases spread through direct contact, especially those sort of fecal oral transmissions, and hand washing is a pretty simple and effective method of stopping disease spread. This sink, which looks kind of crude, but it's actually from a large animal clinic at the vet college. And when I first came here to the college, I don't think we had any sort of sinks for hand washing around the large animal clinic. It wasn't something that they thought about when they built the clinic. And it seems to like, you'd think we'd know about infectious disease transmission at the vet school, but we had to install those after the fact because it wasn't in the original design years ago. So if you want people to wash their hands, you got to provide them with facilities to do that. So sinks and soap and hand drying and all those sort of things that go along with that. And it makes sense. We don't always think about that when we're building barns and we're thinking about how to house the livestock, but we probably need to think about some of those issues as well. The other aspect of personal protective equipment is clothing. And coveralls and boots are more than just to stop your own clothes from getting dirty. When you take those off, you leave the bacteria or viruses behind. And I know this is something that probably we could do, again, a better job of. Many producers don't necessarily do that. I think, the swine industry, obviously with their shower in, shower out facilities, they're worried about biosecurity for the pigs. That also provides some biosecurity for the people. But we maybe don't do as good a job on this field in the beef industry or some of the other livestock sectors as we do in some. So wearing that protective clothing, changing our coveralls regularly. Here's Dr. Clark from the college doing his demonstration. Having boots that we can clean and wash, and having boot washes with soap and hot water, being able to do that. I got a question mark after foot baths because they're really tough to maintain and hard to do well. But certainly if we can wear rubber boots and wash those to sort of prevent contamination. Wearing gloves where appropriate, especially around calving and lambing. And in some cases, maybe considering masks or face shields if we're worried about things like Q fever. And then obviously watching for those important diseases in animals, identifying those signs of diseases such as Salmonella Dublin, maybe abortion problems in sheep. Many of those diseases, we can recognize those in animals. And so if we suspect a disease can be zoonotic, we can obviously then increase our precautions. And outbreaks are going to require sort of even more isolation, even more strict barrier precautions. We've had a number of salmonella outbreaks over the years that have been part of veterinary clinics. And one in particular here at the vet college that Dr. Clark and I dealt with many years ago. We were lucky it was a fairly wimpy salmonella bug and it didn't cause a lot of severe disease, but we knew that we had a case in the clinic, and by the time we diagnosed it, it had not been in isolation, and so we were afraid that maybe it had spread. We cultured parts of the clinic and we could find it just about everywhere. We found it on light switches, anywhere the students or staff were touching things, on the case records, on the door handles, on the feet of the clinic cat. We could culture salmonella, and we were fortunate in that it was a fairly mild salmonella, and we were able to clean up the environment as best we could and get rid of it, but it can last for a long time. Obviously, people with immunosuppression or pregnant women may need to completely avoid exposure and just avoid exposure to those high-risk situations. Just briefly, food safety is certainly a huge topic, and it's beyond the scope of today's lecture. But one of my former professors used to say that food was our most intimate contact point with food animals. That for most people, even those people that never venture on a farm, they eat food, and that's their most intimate contact point with food animals. So meat inspection is certainly an important part of our public health infrastructure. We want to make sure we design those slaughter plants well worry about hygiene with the product and appropriate cooking temperatures and all those sort of basic food safety issues. So to finish off, we need to think about zoonotic infections when we're working with food animals. We don't always probably take adequate precautions. We shouldn't be eating or drinking or using tobacco products, etc., when we're handling animals or in animal housing areas. We should probably think about gloves and hand washing, especially when we're handling sick animals or calving animals or animal tissues of any kind. Dedicated protective clothing, coats, coveralls, shoe covers, boots when handling animals. Should probably launder that equipment separately from your own personal clothes. You may want to consider wearing respiratory protection when appropriate, although I think those conditions are relatively rare. And then we want to think about biosecurity, both of our animals and ourselves, keep our animal areas clean, disinfect equipment after using on animals or in animal areas, maybe minimize the introduction of disease by reducing sort of purchased animals and things like that can introduce new diseases to our herds. So I think that's all I have, Josh. I'm happy to answer any more questions if there are any. And again, thank you for having me. I hope this was useful.
I certainly found it informative, certainly from the perspective of zoonoses, but even I can't believe it's been over 20 years since the Cryptosporidium outbreak in the Battleford. We do have a question that has come in, and the question is, in the interest of the One Health concept, do these diseases spread from livestock to wildlife, and can that make it more difficult to get control of outbreaks?
Yes, some of these diseases could spread to wild ruminants, and for sure, especially if we were trying to eradicate a disease, that would be much more difficult. So things like tuberculosis, we still have some. We had tuberculosis in Riding Mountain National Park for many years in the elk, and it would spill over into the cattle population. Looks like we've probably largely eliminated that. We haven't had a positive case for many years in Riding Mountain National Park in elk or white-tailed deer. But it created a special complication in terms of trying to control that zoonotic infection. It's probably not a huge contact issue in many cases, but if you're trying to eradicate the disease, it does make that much more difficult.
Well, thank you for your time today, Dr. Campbell. There aren't any more questions. You folks do have a couple of moments still, as I have a couple of final things to mention before we say farewell. So please take this as an opportunity to get your questions in. But before we say goodbye today, I would like to encourage everybody to take a moment to fill out the survey. If you watch the chat, there will be a survey that pops up here. Crystal just popped that link into the chat. So please take a moment to fill that out, as it helps us determine future topics for future webinar series. If you need a certificate of participation for CE credits, we are happy to provide that to you, and you can reach out to us by emailing info@saskispca.ca, and we will get that certificate for you. If you are interested in staying in touch with us and learning more about webinars that we hold in the future, there's another link in the chat where you can line up for our webinars sign-up sheet. And then, of course, we invite you to join us for the next webinar in the series, which takes place on December 5th. My notes popped away from me here, so give me a moment to pull those up again. But the next webinar will be on December 5th, which is a Monday at 12 p.m. Saskatchewan time. Our presenter will be Colleen Andell, who will present on Zoonotic, the other half of the story. This webinar will explore the potential contributions of the One Health concept of Zoonotic for understanding wellness, accounting for the interconnection between animal, human, and environmental health. So please do register for that as well. We will do one final check for questions. and it does not appear that any have come in. So once again, Dr. Campbell, thank you so much for sharing part of your day with us. Do you have any parting thoughts for the folks in attendance today?
No, I don't think so. Thanks very much for having me, Josh.
Right.
Appreciate the opportunity.
You're very welcome. And thank you to everybody for joining us today. Hopefully we'll see you on December 5th. And take care, everyone. Bye for now.